Hello, my name is Nicole Weatherwax, registered nurse and student working to obtain my bachelor's degree at SUNY Plattsburgh. Today I'm going to share with you my reflection, looking back on my experiences throughout this course. As I researched a public policy legislative topic that met the course objectives, it became evident that the topic of understaffing was a no-brainer. Understaffing is a current global issue, but more importantly, it has a huge impact on nurses and the public of New York State, including rural areas of upstate New York and my hometown, Glens Falls. The staffing crisis in patient care facilities puts nurses in difficult situations where they are pressured to care for too many patients, as the nurse-to-patient ratio assignments are often out of proportion. 1 to 5, 1 to 8, way greater than the evidence-based practice recommendations of 1 to 4 in the acute care setting. This results in avoidable adverse patient outcomes, decreased patient satisfaction, longer hospital stays, and increase in non-refundable costs, and higher caregiver burnout and turnover rates. Knowing that the evidence research and compared to California hospitals support the need for law, I took this as my opportunity to help. Hospitals which routinely staff with 1 to 8 nurse-to-patient ratios experience 5 additional deaths per 1,000 patients than those staffing with 1 to 4 nurse-to-patient ratios. Also, the odds of a patient death increases by 7% for each additional patient the nurse must take on at one time. Hospitals with lower nurse staffing levels have higher rates of pneumonia, shock, cardiac arrest, urinary tract infections, and upper gastrointestinal bleeds, all leading to higher costs and mortality from hospital-acquired complications, including job dissatisfaction. Among hospital nurses, it's 4 times greater than the average for U.S. workers, and 1 in 5 hospital nurses reports that they will intend to leave their current job within a year. Despite knowledge of this crisis, hospital administrators are campaigning against nurses who support the staffing ratios in an effort to stop New York Assembly Bill Safe Staffing for Quality Care Act from becoming law. Within this realization, the nurses must lobby for safe minimum staffing levels to be passed, ensuring that all facilities be required to submit safe staffing plans, be prohibited from assigning mandatory overtime, and be required to staff using evidence-based nurse-to-patient care ratios. I presented this bill to Assemblyman Dan Steck in hopes to gain his support in providing evidence-based practice facts which have been researched and compared to California hospital results following their mandated staffing changes in 2003. I succeeded in presenting to my local assemblyman, as he was able to make logical points and repeat facts related to understaffing. Assemblyman Steck noted that he was very familiar with the mentioned bill, and he had voted no in the past. He is sided with the representatives of upstate hospitals who are concerned with what will come of small-town facilities if they are forced to comply with mandated staffing ratios, which are believed to be more attainable by larger city hospitals. I then reiterated the fact that this is an essential bill for increasing patient caregiver safety, as many local facilities are often inadequately staffed. He did not deny that increasing staffing would help improve patient care. However, voiced concern for the cost of the small-town hospitals themselves, as hospital administrators too have come to him expressing concern of detrimental outcomes to their bottom line if ratios were mandated, with fear of being forced to close the doors. Assemblyman Steck did provide some informative tips to help nurses in their efforts to lobby for support to mandate set nurse-to-patient ratios in Albany. He also recommended that a comparison of the Assembly version be made to the Senate version of the bill in order to compromise, make revisions, and resubmit it to increase chances of gaining a vote yes in the Senate. He told me that he would be more apt to give support if he could ensure the provision of all upstate hospitals and continued access to local care for residents. He recommended that nurses present evidence-convincing upstate hospitals that implementing evidence-based nurse-to-patient staffing ratios and providing adequate ancillary staff will help improve the nurse staff's ability to provide quality care, in turn saving lives, reducing adverse outcomes and costs, increasing patient satisfaction rates, and increasing staff retention by decreasing burnout without causing hospital financial demise. I have learned a great deal pertaining to policy and politics throughout this course and have enjoyed the opportunity to work with you all. I wish everyone the best. Farewell.